The following program is sponsored by Memorial Healthcare System.
We're moving health forward with Memorial Healthcare System. The opioid crisis.
In 2017, approximately 72,000 people died of overdoses.
Child and teen anxiety and depression.
We have seen a drastic increase since the Parkland shooting.
Women's health concerns.
The problem is we're busy taking care of everybody else and don't take enough time for ourselves.
Building a healthier population. And the future of digital health.
Having that technology is an incredible feeling of being able to progress healthcare to the next level.
Welcome to Moving Health Forward with Memorial Healthcare System. Following one of the deadliest school shootings in U.S. history and fallout from the opioid crisis, mental health in South Florida is at risk on two fronts. The result? An influx of patients seeking urgent treatment and mental health support. Today's hospitals are tasked with tackling these issues at their core through prevention, education, and action.
In America, there's almost 3 million people addicted to opiates, and Broward County is no exception.
In 2017, approximately 72,000 people died of overdoses. The reason that people are dying dates back to when oxycodone was approved and considered to be a non-addictive substance. And unfortunately, people became addicted.
I'd like to welcome you here this evening.
We're having a workshop for the public on the opiate crisis. We also tonight are speaking with Memorial Healthcare.
What treatment options are available and how are they different than, let's say, 10 years ago?
And having them as a partner is an excellent way for us to reach out to the public.
We started clamping down on opioids, and so now we had patients that were addicted to opioids. What did they turn to?
Heroin. And then the drug dealers started cutting heroin using fentanyl.
Fentanyl is a drug 1,000 times as potent as heroin, which is cheap, synthetic. It's mixed in with the drug supply and sold to people out on the street without any awareness of what they're buying.
Because of the opioid crisis, grant dollars have been made available here in Broward County so that people, regardless of their ability to pay, can have access to treatment.
If you're using heroin and suddenly stop breathing from an overdose, Narcan can immediately reverse the effects of heroin and potentially save somebody's lives.
And we, of course, try to talk to the patient about engaging in treatment by being a part of medication-assisted treatment, which essentially is using buprenorphine as a medication to help stabilize the individual and reduce their cravings. If an individual goes through the process of being detoxified, once they leave the structured treatment environment, they often experience strong cravings. Vivitrol is a long-acting medication that, for people that want to maintain abstinence, lasts for approximately a month. So if they get a Vivitrol injection, if they go to use an opioid and/or drink alcohol, they get no effects of a high. If individuals can stay drug-free somewhere around 8 to 12 months, their ability to sustain recovery for a longer term significantly increases. Some patients need more than outpatient medication-assisted treatment. Oftentimes it's because they're also addicted to other drugs, such as alcohol, so people need a more structured inpatient program, and we have that at Memorial Hospital Pembroke as an option.
Very nice, very nice.
This setting allows them to come in and receive medical treatment to prevent adverse reactions to their withdrawal symptoms and really get them prepared to go on their next step of the journey, which focuses on the counseling side of things.
It's really important to get into a behavioral treatment program. In addition to medication, there's peer specialists, behavioral therapy, antidepressants, and other things that patients really need. And the peer specialists are typically recovering addicts who are now sober and out there to help other patients.
When you look at your scars now, what do you think about?
Now, when I look, I'm actually grateful because it is a daily reminder for me of what I went through, what I did to myself through my choices, why I don't want to go back to that. I get to tell people my story, and hopefully I can point them in the right direction so they can change.
The peer specialist provides the psychological support for these patients. At the same time, we provide the medication to control the craving and the addiction.
If you've ever heard a baby cry in the throes of addiction, it's very painful and it's very sad. So in 2015, we started a program called Mothers in Recovery. We wanted to give women that had opioid use disorders the opportunity to detoxify and deliver their babies drug-free. And we've had 94 births, and 88 of those births, the babies have been born drug-free, or a 93% success rate. Because of the medication-assisted treatment program, the Vivitrol program, the Mothers in Recovery program, I know it's made a big difference for our healthcare providers here in our emergency department, because now they feel like they have an option.
From academic expectations to cyberbullies to school lockdowns, today's children and teens are faced with real-world pressures that may lead to anxiety or depression. Here's what the experts say we can do to help.
We have seen a drastic increase in behavioral health patients in the emergency room since the Parkland shooting. It was in our backyard. It hit the community hard, and the kids, it got their wheels spinning.
Children face enormous pressures these days. Social media is a pressure that didn't exist when I was in training, and the pressure to be on all the time to their peers and families, where mood and anxiety is determined by how many likes you get.
There is the pressure of school and life in general to please your parents, and believe it or not, our numbers are very cyclical around the state testing. Final exams, midterm exams, you see increased anxiety levels and patients showing up to our emergency room for anxiety and depression during these times.
The goal, of course, is to avoid emergencies.
She had like a bunch of girls over, she just wanted to do something.
One of my daughters has been coming to Dr. Ruby for about a year, and the other daughter started maybe 6 or 8 months ago. Principally because the first daughter was really seeing significant benefits from having a chance to talk with Dr. Ruby and work through some of her issues about some anxiety related to school.
Just to prepare for like the AP exams.
You don't want a fever of 102 to become 104. So seeking out treatment early, that's consistent, that's regular, is of the utmost importance.
I've had so much support here. This is like the place where I come to get grounded, get collected, and be able to get better.
I think he's helped them in terms of focusing more and not being quite as anxious about things, and it's been very positive.
Kids and parents, and I'm guilty as well, you've got to put the phone down. There's no amount of games or reading or news or celebrity entertainment news that's going to replace that time and that contact with your kid.
Be aware. Speak to your children. Pay attention to them. Also notice some of the little things. Changes in school performance, changes in eating habits, changes in sleeping habits, change in levels of energy, feelings of hopelessness, helplessness, worthlessness. Pay attention to self-esteem. Don't just necessarily say, oh, it's a stage. Stages don't last for 2 to 3 or 4 weeks. If there's a family history of anxiety, plus these changes, that makes it more worthy of an assessment. Nowadays, screening for depression is part of an annual physical. So it's always good to start with somebody who knows your child the best. More often than not, that's a pediatrician. To be able to say, I just think that things are different.
Open up the phone book or Google on the internet a licensed case social worker that does therapy in your community, and just get that entry point. Reach out and make that connection. We've got to get this done for our kids and make sure that they have a good transition into early adulthood, and maybe they can be part of the solution tomorrow. So that's really where it needs to head.
Did you know? Research shows a 73% improvement for teens who participate in group therapy versus other patients. We women are notorious for putting our own health care on the back burner. Recently, I hosted a panel at Memorial Healthcare System where we had a chance to ask the experts about women's top health concerns.
As women in America, we take on everything. We are wives, we are moms, we are daughters, we have careers. We juggle so many things. The problem is we're busy taking care of everybody else and don't take enough time for ourselves. Can you guys relate?
Yes. Absolutely.
But now we're taking a break from taking care of others to focus on our own emotional and physical needs. And here to help and to put it in perspective, Memorial cardiologist Dr. Bada and primary care physician Dr. Shareba. Welcome, doctors. Thank you for being here.
Thanks. Great to be here.
Dr. Bada, let's start with you. You are a perfect example of this, a successful doctor for more than 20 years and a woman. I imagine you have faced this struggle as well.
You're absolutely right. We as women are so involved with taking care of everyone else that we often neglect our own selves. And so it's extremely important for us to make time to exercise, to eat healthy, and to try and relax and avoid stress as much as we can.
All right, Chris, what stresses you out?
Work-life balance is a huge stress. Balancing work, the teenage daughter, homework, school projects, social schedule, grocery shopping, and errands.
How much time would you say you average into your day?
I have the car pickup line time. Read a little book, listen to some music, play some games on the phone. For me time, really not much, really, truly, which is definitely, I know, an issue for me.
And you're not alone there.
I have good company.
Right.
In my peer group, we have people who, they know that there's something wrong, but they're so busy. And they say, okay, no, I'm fine, I'm fine, I'm fine. And a lot of times, people are afraid to find out what it is. What do you say to the people who have that fear because they're fearing these horrible diagnoses, cancer, or that they have heart disease or something like that? So what can you say to her?
Dr. Shareba, I imagine that women come into your office and perhaps they've been putting these appointments off too long for this exact reason.
I really think that everyone, but particularly women, should have a really good, close, open, very forthright relationship with their primary care physician. And that should be built over time. Like any other relationship, it takes time to nurture because even though it's sometimes scary to think of what could happen, it's scarier to just ignore it and to just let it go. That primary care physician will make sure that you get all the screenings, all the preventive health care. They'll ask you about your diet. They'll ask you about your stress level. They'll ask you about exercise.
You know, you said the word stress, and that goes along with being busy. It has to do with not having enough time. Stress, we know, can lead to some pretty serious health issues. It does include high blood pressure and strokes. All right, so here's the question. Who here has a history of strokes in their family?
None.
No. Okay, so chances are if there's no history, then you guys may not be familiar with the warning signs. And doctors, I imagine that this is something that you see as well. Dr. Bada.
For sure, yes. And it's very important to recognize the signs and symptoms of a stroke right away because if it's treated immediately, there is a very good chance of a full recovery. And the typical symptoms of a stroke would be weakness on one side of the body, difficulty with speech, sometimes difficulty with vision, occasionally strange sensations on one or more sides of the body. So if anybody experiences these symptoms, they should immediately notify 911 and get to the hospital.
All right, so with that said, any questions you guys have?
If you don't have a history of stroke or heart attack in your family, could it be developed in the future?
Dr. Bada?
So the risk factors for both strokes and heart disease are very similar. The most important being smoking, high blood pressure, diabetes, strong family history of heart disease. That means either a sibling, parent, or child who develops heart disease or strokes before the age of 55 years for a male relative and before the age of 65 years for a female relative.
It's important to add also for other diseases besides stroke and heart disease that, again, family history is only one part of the risk category. For breast cancer, colon cancer, cervical cancer, not having a family history does not mean you're protected against those cancers, and that's why it's important to get those screenings.
You know, sadly, every one of us in this room right here has probably been touched by cancer. The Centers for Disease Control estimates that more than 250,000 women died from cancer last year. And for those who survive, cancer treatments can be intense. You know, we talk about losing hair, we talk about losing appetite, but I imagine, Shamina, the emotional effect it has is even stronger.
It's even stronger, and at the moment you're going through something like that, you're thinking about your family, your young kids, your husband, and it takes a toll on you physically and mentally. And I'm here almost 3 years later, a survivor of breast cancer, and I am living my life. And there is life after cancer.
Congratulations. Okay, another question for you. Who here is in their 40s or their 50s? All right, so welcome to this new thing, this new generation, guys. Have you heard the term the sandwich generation?
No.
Okay, well, here's the deal. Nearly half of middle-aged Americans today are sandwiched between a parent over 65 and either a young child they're raising or a grown child they still support. Does anybody here have any questions when it comes to having an aging parent who they need to take care of? Allie.
My dad is suffering from onset dementia, and he's out of state, and I was wondering if there's any suggestions you might have to help me manage his care.
You know, the incidence of dementia is climbing dramatically as we have older and older patients. The risk of dementia, if you're over 85, the incidence is about half. Almost half the patients will have some dementia. It's important, first of all, to make sure that he gets the best care for the dementia. Unfortunately, there's no medication to cure it, but there are some medications that can maybe help slow the progression. It's then important to establish a team of providers, for example, social worker that might help plug them into resources.
Okay, Dr. Bada, I'm going to steer this last question to you. Is it true that red wine and dark chocolate are good for us, right? We want this answer.
Yes, I hope so. Definitely.
So alcohol in extreme moderation has some beneficial effects. And when we talk about extreme moderation, for women, that refers to not more than 4 to 6 ounces of, for example, red wine a day, or maybe even just a few days a week. And for men, that number is a little more. It's maybe 2 cans of beer, but not more than that.
What about that dark chocolate?
The dark chocolate, yes. Now, there are some beneficial effects of dark chocolate in terms of memory and, things like that.
Okay, so not all bad.
Not all bad.
Thank you, doctors. Thank you, ladies, for being here. Great advice from everybody and great questions. And remember, all of you ladies out there, make time to take care of yourself. It is truly important.
Did you know? Studies show women who are stressed are more likely to experience depression and anxiety than men who are stressed. Where you live can impact your health. Social determinants like poverty, transportation, and limited access to healthy food can affect your overall well-being. Memorial Healthcare System connects people to resources that improve population health and build a healthier community.
Social determinants of health are key in patients' overall well-being. Up to 70–80% of the patient's overall well-being has to do with things like social status, your economic status, your access to food, to transportation, your social support, right? Are you in a relationship? Do you have family? Do you live alone? These social determinants of health impact a patient's ability to do well. If you are a patient who has financial insecurities and you can't afford your copay, do you choose to use the $40 for a copay to visit the doctor, or do you choose to use those $40 to provide food? If we don't provide intervention for patients' social needs, what we do see is patients continue to return to the hospital.
Many times we identify that they're there because they could not afford the medication, and then therefore they go to the emergency room. Why? Because they know that they can go to the hospital to get a blood pressure pill, or they can go and get insulin, which they could not afford at home. Memorial Healthcare System has 8 primary care centers that are strategically placed throughout the South Broward District. There's a charity program that allows individuals that live in the South Broward Hospital District to be able to receive primary care and address all their preventative measures as well as manage their chronic care conditions. And that is truly what population health is all about.
And so what we do at Memorial is we identify when a patient has a social need, and we provide interventions for that.
Hi, darling. How are you?
Once the patient is identified as having a need, the health coach or our social worker will meet with the individual, whether it be in the office during their primary care visit, or we can deploy and go out into the home. She takes an assessment of the home, whether it be looking in their cabinets to see if there's food, looking in the refrigerator.
So you need some vegetables, fruits.
Right. It's been hard because, between moving and buying things in the supermarket, and, it's been a lot of hassle, really.
Angela is a mother, and she's an advocate for her son. Her son has a cognitive development delay, and Angela has been trying to get him Social Security for the last about 5-6 years. So I've been on this journey with Juan and his mother for 3 years now. Have you been in touch with his disability attorney? First off, we applied for Medicaid. He got denied. I reapplied 2 times. On the 3rd time, he got approved. Then his Social Security was approved. Then I applied to him for TOPS transportation, Broward County Paratransit, and he was approved for that. And then with the Medicaid, he was approved also for food stamps.
Thank you for
You're welcome. More than that.
She's enabled to help me, give me encouragement, tell me don't give up.
We're here for you.
Keep on going. And I really appreciate all the help that she has given me, and especially for my son.
The ultimate goal is to reduce symptoms and get them to a state where they have a positive overall state in their home.
When I think about this program and I think about population health and the work that we are doing as an organization, it fills my heart with joy. I was once on assistance from the government, so I understand and I really have a respect for the individuals who don't know how to find these resources. I want to make a change in one's life because there were people that were there for me when I did not have.
Did you know? In adults over 21, diabetes ranks highest in overall healthcare spending at $101.4 billion. In an age where your watch or phone can monitor your body systems and your healthcare is basically at your fingertips, knowledge is power, and digital health is leading the charge.
Digital health and healthcare is the ability of patients to really connect with the healthcare team and the tools that they use to be able to connect with the healthcare team. And that empowers them to really take ownership of their health. And not just as patients, but as caretakers, as family members, you're now able to be part of that care team for your loved one. And we're really at a turning point for healthcare and the ability of our records to be digitalized. Here at Memorial, we have Memorial MyChart, and that is our health portal. If you visit a Memorial physician, if you visit one of our hospitals, you have access to your records, your lab results, your radiology results, your mammogram results. You're also able to message your physicians. You can electronically communicate with that physician, request refills, ask simple questions. You can schedule an appointment. You can pay your bill. You can check in without having to wait in the doctor's office and fill out a lot of papers. You also have the ability to share that record with another provider who might be in a different organization.
We have well over 100,000 patients live within MyChart. What patients say is, this is a game changer. This allowed me to understand my health.
A lot of patients today have fitness wearables, and they're able to download information, glucose monitoring information. They're able to download it directly to their record. So now they're sharing information about themselves. They're able to access information, and it helps the providers to really care for that patient, not just during that episode of care, but throughout, and intervene much quicker. If they see that the blood pressure, the heart rate, or the weight is out of flux, they can directly connect with that patient in a much more real time.
MyChart Bedside is a tool that is used by patients when they're admitted in the hospital. It gives them access to the results as they're coming in. So if they just had lab tests that morning, as they're resulted, they're available to the patients and their families on a bedside tablet. In addition to seeing results, there's access to patient education. We're able to provide our patients with a transparency website where they're able to access information about prices for different procedures, for their mammogram, for their chest x-ray, for routine lab work. It's also about the quality of care that they're receiving. We want to let patients know what our typical waiting times are. The surveys that are conducted after a patient's visit, we want to let them know what the average response is and what the response is for our patients that visit with our healthcare system.
Memorial Doc Now is an application that you can download on your phone, on your iPad, or even your PC to see a doctor 24 hours a day, 7 days a week.
Good morning, William. What's the onset of your illnesses?
The entire visit itself can be done within 15 minutes. And the best part of it is that at the end of the visit, if you need to have a prescription is sent electronically to your pharmacy of choice.
Hold the phone towards your mouth and just open your mouth for me a second.
Having that convenience factor will increase your chances for staying healthy. In almost 2 years, we've seen about 10,000 patients using this app. We have hit 94% patient satisfaction. Patients want it.
I see a lot of progression with regards to wearables that are going to become much easier for patients to monitor their results, their diagnoses. I also see artificial intelligence as playing a role, as well as even robotic companions for patients. And having that technology, being able to develop that type of technology is an incredible feeling of being able to progress healthcare to the next level.
And with all of this technology, there really are no excuses when it comes to taking care of ourselves. Thank you for joining us on Moving Health Forward. For more information on today's topics, visit NBC6.com/movinghealthforward.
The preceding program has been sponsored by Memorial Healthcare System.